From TBD, this is News Talk with Bruce DuPoit.
Welcome in. It is good to have you with us on News Talk. Bruce DuPoit has this Friday off, and we're going to get started with a disturbing new report that shows prescription drug abuse now surpasses the abuse of cocaine, heroin, and methamphetamines. What to do? Some experts are encouraging the FDA, along with the pharmaceutical companies, to develop safer products. Michael Barnes joins us now from what is called the Center for Lawful Access and Abuse Deterrent. Michael, great to have you here.
Thank you for having me.
So much for your time. This is Washington, after all, and sometimes advocacy organizations with mom and God and apple pie sounding names aren't always what they seem. If you would please give me Claad's mission statement and who's paying the bills.
Okay. Claad is a coalition of not-for-profit and for-profit organizations, all of which are committed to reducing prescription drug abuse. And we are funded by those same organizations. We have a very low budget. I, in fact, volunteer, but we have reached out to pharmaceutical companies as full disclosure. We have received some funding from a company named King Pharmaceuticals. But on a whole, we're finding that pharmaceutical companies aren't too fond of our message because we're calling them really to take greater responsibility for this problem.
And that is an important part of this, and I think something that separates your organization from others. Everyone's looking at this right now and saying, gee, we got to do something, but you actually have a couple of pretty hard and fast proposals. How bad is the problem? And is it overstating it to say that this is an epidemic now?
It's not overstating it, especially when we have an opportunity to speak with the parents who've lost their children. We work very closely with the National Coalition Against Prescription Drug Abuse, which was just founded this year because the CEO, the founder, lost her son, Joey Rovero, last December to a lethal combination of alcohol and legal pharmaceutical products.
And we very often, I think, talk about the drug abuse problem as something that you buy on shady street corners from people that you would not normally associate with. It's not that at all. No. These are things that kids and adults find in the medicine cabinets of just about every house in the United States.
You're absolutely right. Yesterday's survey results really did shed light on the fact that most of the prescription drugs that are being abused are coming from friends or family.
Why has it taken us so long to recognize this problem, first of all? Or is this a dynamic shift in the problem to begin with?
I think we have been sidetracked at recognizing the problem, but I also think that there's been a lack of leadership. And if we look at examples from other industries, going back to 1980, for example, we know that when aerosol spray cans were harming the environment, that the manufacturers of those products stepped up, and so did the EPA, and they solved the problem. So now we have the issue of CFCs polluting the environment. But that has not occurred in the pharmaceutical industry. We don't see many pharmaceutical companies saying, we have this social responsibility to make our products safer. That needs to change.
Is it because these companies don't recognize the problem? Or does a lot have to do with sort of the state of what are prescription drugs in this country right now? They're formulas, they are compounds that companies guard very closely because they know their window to make money off these drugs is sort of limited before they become generic and frankly cost a great deal less and are much less of a profit center. Does that figure into things here?
I think, unfortunately, part of the problem is that some pharmaceutical companies are able to profit off of the abuse of their products. And so we have to
And that's a serious charge you're making.
I know. I'm not popular for making that charge, but it's a matter of fact. And we need the FDA to step up and say, you've got to make your products safer. In addition to testing for the safety and the efficacy of your medications, you also have to test with human abuse liability studies that the medications are abuse deterrent, are abuse proof to the greatest extent possible.
Is it possible? I mean, do we understand making these formulations abuse proof? Are there things that drug companies can be doing right now to make, for example, pain relievers, drugs given to patients who have chronic pain, to make them less likely to be abused?
I believe that there is, and I know that there are some companies that are researching products called abuse deterrent formulations. And I'm an attorney, so I can't speak to the clinical portions of the research and development, but I do know that they can use physical barriers or pharmacological barriers to prevent certain forms of abuse, I don't think any solution will resolve all of the abuse problem.
But then that's frankly not what you're asking for either.
No.
We need to get started on this problem right now. When you take a message to drug companies, for the overwhelming number of them, it is a negative one. Is it that they don't even want to hear about the problem, or do they say your approach to it is wrong-headed? I'm asking you to argue the other side of the question here. What is their defense?
Well, a lot of the pharmaceutical companies that we have approached to try to bring into our coalition say that they're involved elsewhere. And they might say that they're working with other abuse prevention organizations. But that involves public educational campaigns, which are very important in funding those sorts of time to talk campaigns, whatever the case may be. But they also have to take the responsibility on the research and development side. One
of the things that you are talking about, too, is more federal regulation, and that falls on the shoulders of the Food and Drug Administration. Well, now, this is an organization that, let's be frank here, has not done the best watchdog job in years past. We know that, much to everyone's chagrin. Is it beyond the FDA's ability to police these drugs? It's not beyond the FDA's ability, and we're not calling for the FDA to take full responsibility. Of course, the federal government has actually done very well. This drug czar, Director Kurlikowski at the Office of National Drug Control Policy, is very well focused. Our DEA is doing a tremendous job. The DEA has really responded nimbly to the problem of prescription drug abuse, and in fact on September 25th is having a national prescription drug take-back day across the country with 3,300 sites that are participating. So the FDA just needs to do what it can within its congressionally authorized authority. You bring up something that I think is very important here. It's what can the rest of us do in the meantime? Because maybe that's where the responsibility is going to fall here, because everyone else seems to be figuring any other way to get around the problem other than, yeah, this is a problem, let's tackle it. What can you and I do right now to lessen the chance of these drugs falling into someone who's likely to abuse them? I'm glad you asked, because it gives me a chance to talk about the fact that our strategy, Claad's national strategy, does call for a multi-sector approach, and I don't want to give the wrong impression otherwise. So what patients and the public can do is safeguard their medications. It's very simple. I've got this pin on Lock Your Meds. It's National Family Partnership's Lock Your Meds campaign. October 27th is National Lock Your Meds Day. So patients can secure their medications, not ever share them, and of course not sell them. It sounds very straightforward, and we know that that'll be an important part of this. But sometimes the people for whom those drugs are being prescribed are abusing them as well. You do what you can in something like that, and then we'll refine our approach later on. If you lock them, if you keep them out of the hands of people who might, I guess what you're doing is you're narrowing, or you're shrinking the circle a little bit. That's right. We're trying to reduce that 70% of cases in which people receive their abused medications from friends or family. That's an easy place to start. Yes. What then beyond that? Is this something that people need to start agitating, bringing the issue up, letting their elected representatives know, we're very concerned about this, what are you doing about it? Yes, we've talked about at the federal level. At the state level, there are a couple of important things that people can demand of their state governments. Number one, to implement an electronic prescription monitoring program, and then to make sure that prescribers and that pharmacists are using that. A number of our state PMPs, prescription monitoring programs, are not requiring use. That has got to change. And then we also need to make sure that medical education improves, and that the people who are prescribing powerful medications know that they have to prescribe very carefully using universal precautions, and that they need to screen for abuse regularly, refer to substance abuse treatment. And here's another place. This is the old medical reporter in me coming out now. This is another place where we as the consumer can actually influence a number of people. Talk to your physician. And when that prescription is written out, hey, I've got some concerns about this. Are there other things that you could be prescribing that don't necessarily carry the risk? What do you know about this? How can I make sure that this is not a problem down the road? You're absolutely right. I'm going to call out a friend of mine who was saying that when he had dental surgery recently, he got 120 very powerful OxyContin pills. That is sheer irresponsibility on the part of his oral surgeon. And it happens a great deal more than we would probably care to think about. And even if you are a conscientious person, you take the meds, and when you're done with them, leave them in the medicine cabinet. All you're doing is putting very powerful drugs in a very easy place to access. And if you don't think that people go and look in medicine cabinets and things like that, you are very much mistaken and very naive about this. This is a huge problem, and it is something that everybody can take some responsibility for right now. And then I think we need to widen the circle a little bit and make sure that the drug companies, the governments as well. Great work that you're doing on this. If people need more information, where's a good place for them to go?
They could go to lockyourmeds.org to learn about National Lock Your Meds Day and get some education through their publicly available materials. And they could go to claad.org, claad.org.
And we talk about locking the meds. There are a number of companies now coming out with actual medicine cabinet friendly things where you can put these things under lock and key. It's worth checking out because the scope of this problem now really is breathtaking. Michael Barnes, thank you so much.
Thank you.
Good to have you here.